Everyone, good evening. I'm Dr. Deepika Chamoli, and I hope that I'm audible and visible. Please give me a thumbs up if everything is good to go. Great, Hadia. So, once again, a very refreshing good evening, Saturday good evening to all of you from Dr. Deepika Chamoli. I'm the founder and director of Speaking Cube Online Mental Health Consulting Foundation. And in Speaking Cube, we organize free webinars every month, sometimes once in a month and sometimes bi-monthly. So welcome back to the first webinar of 2026, which is for especially the psychology students, PhD scholars, and psychology professionals, those who are practicing psychology. So let me give me a brief introduction apart from my affiliation. I As I have mentioned, I'm the founder of Speaking Cube Online Mental Health Consulting Foundation. Apart from that, I'm associated with Southern New Hampshire and St. Leo University, USA, in the capacity of adjunct professor for psychology. And I feel that psychology is getting updated every day. The emotions that we were dealing with long back, probably 5 years ago or 10 years ago, when I started doing psychology 20 years back, 22 years back, there has been a lot of changes because of the technology, the role of technology that has come into play, the role of AI, and many more things. So let's talk about, in today's webinar, we are only going to touch the basics of counseling skills. So let me share the screen and let's go ahead. In the meantime, if you people have any question, we can take up the question at the end of the webinar. I hope my screen is visible to everybody. Is it? Okay, great. So when we talk about counseling, we all know what counseling is, being maybe we have heard about counseling, or we have attended a session of counseling, or we are a counselor ourselves, or a psychologist ourselves, or a psychology student. That means a budding psychologist. So when we talk about counseling, it is not only related to the psychological aspect, but it is at the personal level, it happens at the social level, it happens at different level. Here we are going to talk about psychological counseling. So what is counseling? It is the provision of assistance and guidance in resolving personal, social, and psychological problems and difficulties, especially by a professional. But when it comes to psychological counseling, it is the application of mental health, psychological, or human development principles through cognitive, effective, behavioral, and systemic intervention strategies that address wellness, personal growth, and career development, as well as pathology. It is a standard definition, right? There is nothing which I have added from my end, but these are the areas that we actually address the in terms of dealing with a client. So first we need to understand that when a client comes to us, so forget about these core skills, because I will be talking about the core skills and the basic principles. But the first thing I would like to ask you all, first thing, what should be the first thing for addressing the problems or the issues of the client? Quickly write down in the chat box. Quickly write down in the chat box. What is the first thing? What do we think? If I am a client, I'm a human being, I can also have issues. If I am a client, what is the first thing that I will look up to in a psychologist or a therapist or a counselor? We have 18 people here. Understanding. Very good, Yamini. Yes, understanding and rapport and trust. Leah, excellent. Yes. Comfortable and non-judgment environment. Right. Empathy. Exactly. Rapport building. Yes. Any other thing? vigilance. Okay. And okay. So probably you people have already discussed few of the principles that we follow in counseling, right? If suppose I have to go to a counselor for my problems, what I will think about? What I will think about? I will go to a person who should be able to who should be able to lend ear to me non-judgmentally, without any judgment. He should be able to give me enough of time. Now, when I'm saying enough of time, it doesn't mean that we should be there for the client 24 by 7 to listen to the problem, because then we will be taken for granted. So there are certain guidelines that are being provided to the psychologists or the counselors to handle the cases in the correct manner, appropriate manner within the time frame, so that the client can get the benefit as well. So let's talk about all these skills one by one. So there are only three core skills that we have in counseling. First is active listening. Now there are different types of listening. Active listening is one type of listening, right? Now, when we say active listening, what is it? Is it different than empathetic listening, or is it different than say ignored type of listening? Because there are various types of listening. There are 6 different types of listening. But then in psychology, either we utilize active type of listening or we use empathetic type of listening. In active type of listening, we are there 100% in here and now in front of the client. That means my demeanor, my behavior, my non-verbal and verbal communication should be such that the client should feel heard, that the client should feel that at not at even a fraction of second, my psychologist or my doctor or my therapist got distracted or got involved in his or her own chores, right? So that's that kind of listening is known as active listening. Now, what is the difference between active and empathetic listening? In empathetic listening, we respond. Most of the times we respond actively. We are there to the client, we listen to the problem, plus we add some empathy, and then after adding empathy, then we respond to the client. But in active listening, we are just there. We have empathy, but then there is no need of responding verbally in front of the client. But non-verbal behavior definitely will be there. So second is being aware of the non-verbal communication. Obviously, communication plays a huge role, and communication in itself is the base, the skeleton of counseling, because counseling is nothing but a kind of talk therapy, right? We are treating the client, we are managing the cases only by talking. And then all of that comes only when there is a good rapport. All of that comes only when there is a good base. So let's talk about these basic principles first, and then we will move on to the core principles and the advanced principles of counseling. So the basic principles are as follows. Each client must be accepted as an individual and dealt with as such. That means you have to deal with the client non-judgmentally. If the client even if the client has committed heinous act, but the client should be a client to you. And it is, I know that is very, very difficult, because those who are working in forensics psychology or criminal psychologist, they keep on dealing with such kind of cases off and on. But if you will see a criminal, you will, and you are judgmental about your client, you will never be able to treat the client. And then the client will never be able to live his life as a normal person, right? So if a patient comes in front of a doctor, the motto of a doctor is to treat the patient, irrespective of who and how and why of the issues. Counseling is basically a permissive relationship. That is, the individual has permission to say what they please without being reprimanded or judged. So this is also something that we need to understand. And that's how we need to groom ourselves. Being psychologists, we need to groom ourselves in such a way that We should definitely create an unset boundary with the client. We should not be too close or too apart from the client. There should be a warm therapeutic relationship. So Carl Roger has written a lot about warm therapeutic relationship, that we need to develop the motto of uh, how can we treat a client. We can treat a client with, first step is by creating or by establishing a warm therapeutic relationship. And then if we have a warm therapeutic relationship, it is firm. There is some kind of firmness, there is some kind of formality, but there is a lot of approachability in it, and there is no judgment, because the client feels that yes, my psychologist is there for me, and whether she'll say yes or no, but it is going to be for my benefit. Counseling emphasizes thinking with, not for the individual. So when we talk about counseling, it's all about thought process. It's all about thinking, but not for the individual means we are not judgmental about it, and we are only solution focused. We are not problem so focused. If being a psychologist, we are problem focused, we can never be able to, or we cannot solve the issue of the client. We cannot give any proper solution to the client, and the client will always be unhappy with us. So what is to be done? To reach this stage 3, this stage 2 needs to be taken care of nicely. To reach to stage 2, stage 1 needs to be taken care of nicely. So all decision making rests with the client. We will never take the decision on behalf of the client. So I'm going to discuss in between. I will be discussing few cases that I have dealt with in the past 10 years ago or 15 years ago, maybe. So all decision making rest with the client. A lot of couples come to the psychologist for couple counseling, right? Now after couple, maybe if you are connected with the legal psychology department, or if you are doing your own practice, in both the cases. Now sometimes some small hassles are also there in the relationship, in the form that is being reflected in terms of relationship issues at various levels, at various domains. So at that point in time, you should provide a common platform to the client. 60 plus, a couple wherein the husband was 67 years old and the wife was 65 years old, both were retired from a government job, right? And they were holding director position at both at two different organizations, and they came to me, and their kids are also settled, they are grandparents, but there are small issues were there. The expectation of wife was different than the expectation of the husband, right? So you cannot say that wife is right or husband is right, because when you are in mid, you have to be unbiased. When you are a psychologist, you have to be unbiased and you have to focus on how I can solve this problem. If the problem is arising from wife's side, then definitely there must be some problem at the husband side as well. So you need to create or establish a kind of environment during the therapeutic process so that they can discuss about it. And when they will discuss about it, then what happens? They get the solution. They get the solution because they are watching and reflecting back onto their own issues as an observer. And when we see things as an observer, it's only the solution that we get. So in this particular case, how I solved it, they took, I think, 5 to 6 sessions, couple sessions, and I just created an environment for them, a platform for them. They discuss what they want and what they don't want from each other. And slowly there were certain cognitive distortions which were addressed in both of them. And now they are living a very happy life. And at this point in time, and I'm talking about why I am talking about an elderly couple, because an elderly couple has actually a rigid thought process because they have lived their life a certain way for so many years. If a person is 67 years old, he has a particular belief system he's following for years together. Same goes to the wife, right? The younger couple is more flexible because obviously they have not spent these many years living a certain way, right? So the comfort zone is a bit flexible in the younger couple. So moral of the story is, these are the basic things that we need to understand, because creating the platform is very important. Now, factors that influence change. Physical setting is one of the important factor. Now, if I talk about my practice, I started with physical practice. I started with one-to-one session, and now 90% of my sessions are happening on the online platform. So obviously, these are two different things. Taking the session on the physical mode and taking the session online counseling or tele-counseling, these are two different things, but definitely it has a single vertebra. Single vertebra means, same vertebra means there are certain fixed things that we need to understand and follow as far as counseling is concerned. Pehla kya hoga? Privacy. Privacy is very important. If the client feels that whatever I say is going to be with the therapist, the client definitely will come to you. So we need to assure the client that maintaining privacy and confidentiality is first and foremost important. Do not discuss about your client anywhere. Do not discuss your client even in your class. You can obviously mismatch. You can mix match. Even when I discuss, it's always a mix match. It's not one case. And maintaining the anonymity is very important. So it's very important to understand that privacy and confidentiality is not something which we agree for. Everybody is actually deep into it. And if I am facing some problem, maybe depression, maybe stress, maybe anxiety, I don't want others to know, because it is very, very personal. Then quiet environment and comfortable environment should be there, if at all it is a physical setting. Suppose it is not a physical setting, in the tele-counseling setting, obviously privacy, confidentiality first and foremost things. And then you should not have any kind of distraction in your environment. You make sure that you have a good internet connection. Make sure that your video and audio is clear. So at the starting of the session, I've just asked you that, am I audible and visible? Please ask from your client, because nowadays also 70% of the cases are happening on the online mode, and probably in future 100% of the cases will happen on the online mode. And you need to create a very peaceful environment. Be very careful about the kind of background you have, about the kind of backdrop that you are using. You cannot use a backdrop with a fire if you're taking the session on the online mode. We have certain backdrops with fire and with snow and with, so all these are distractions for the client. So have a very some background with light color, pastel colors, right? Something of that sort. That means you are not giving any kind of bad trigger to the client. Now, let's come on to the active listening. Now start with the core skills. What does active listening do? I have told you, I've mentioned what active listening is. So active listening by the clinician encourages the client to share information by providing verbal and non-verbal expression of interest, focusing on all aspects of client's expression. Now, when being a psychologist, when I am in active listening mode, there'll be no distraction around me. When I'm saying distraction, there'll be no phone. There'll be, suppose I'm taking the session on the laptop. So my laptop will have only one window. There'll be no other window open. I should mute the notifications so that it should not disturb me, because this is how our brain works. Listen to the tone of our voice. Even if I have looked at my mobile once, Just a look is going to be a distraction, and I'm going to miss certain information, which is very, very important as far as the client perspective is concerned. So I, being a doctor, being a psychologist, need to be 100% there without any distraction. Minimize as many distractions as you can. Then when a client is opening the heart out, when the client is pouring the heart out in the history taking session, first session, which is very, very important, what should be done? You are not only listening to the tone of the client, you are not only listening to the verbal communication of the client, you are listening to the words of the client, which is verbal communication. You are basically paying heed to the non-verbal. That means the movement of eyebrows, the movement of eyes, the movement of neck, whether it is right or it is left, right? Everything talks a lot about the client. The angle of the lips, everything matters. How the client is speaking, the tone, the amplitude, the pitch in the verbal communication. So we need to pay heed to the verbal communication as well as the non-verbal communication. When it is verbal communication, what do we need to understand? Words. So as far as the statistics is concerned, statistics says when you're taking the client, when you are taking the session on the physical mode, 8% words. It is a statistics. 8% words are important. That means out of 100% of communication, only 8% is the verbal communication. And 57% is the non-verbal communication. Rest is your tone, pitch, amplitude of the voice. आप कैसे हैं? आप कैसे हैं? आप कैसे हैं? आप कैसे हैं? These are 4 different ways. Which one was better? If I may ask you all, please answer in the chat box. Which one was better? आप कैसे हैं? This one was better. Why? Because it was spoken at a particular amplitude with a particular pitch. Although the words were same, but these things were different. So the perception of these sentences is different. Same goes to the client. So when the client is speaking to you, do not only pay heed to the words of the client, but pay heed to non-verbal and verbal communication of the client. Because if there is a mismatch between the verbal and non-verbal communication and the story of the client, that means there is some other thing which is going on and you need to explore. Now, when we communicate with the client or the client communicates with us, the client says, "Mujhe bilkul acha nahi laga." You perceived, okay, the client has not liked something. Now, in between, there are 2 things that need to be understood. It happens in most of the cases, what the client speaks, what the client intends to speak is different. And then what we perceive and what should be perceived is different. So all these distractions lead to such kind of upheavals in the process of communication. Listen to the cues to the client's feelings, and you can listen to the cues to the client's feelings only when you are aware of what the client is saying, what the client is intending to say, what you have understood, and what is the interaction, what is the resultant interaction of all these things. So listen for generalizations, deletions, and distortions. So what the client is generalizing about. मेरी तो किस्मत बहुत खराब है, मेरे साथ कुछ ठीक होता ही नहीं है। अच्छा आप इसको छोड़ दो। नहीं मुझे ना आजकल बहुत ओवर थिंकिंग होती है, नेगेटिव थिंकिंग बहुत ज्यादा होती है, मैं क्या करूं? 24/7 मेरे दिमाग में चलता रहता है कि आई एम ब्लेमिंग माई सेल्फ। सो व्हाट आर दीज? देयर आर सर्टेन जनरलाइजेशंस दैट द क्लाइंट हैज क्रिएटेड इन द ब्रेन because of certain traumas in life. Nothing in the world. If there is no organic issue, that means if there is no brain injury, there is no accident, there is no disease, brain disease or spinal cord disease, if there is no such event has happened to the client, then whatever is happening is because of either the genetics or because of certain traumas in life, right? And genetics will also appear only with certain traumatic trigger. So we need to understand that with that trauma, with that particular trauma, or with a series of trauma, what all distortions and deletions and generalizations the client has created over a period of time. Listen for common cognitive and emotional themes. जब हम किसी के साथ बात करते हैं, we always understand that there is a peculiar way, there is a particular way of speaking, of discussing, of explaining things. And we all have that, depending on our personality, depending on our experiences. And it speaks a lot about our cognitive and emotional themes. Right? So we need to pay heed to that. Now, there are 8 counseling skills that we need to understand. Basic counseling skills when I'm talking about: rapport building, silence, attending, reflecting and paraphrasing, summarizing, questioning, focusing, and immediacy. Right. So let's talk about them one by one. So when we talk about communication, obviously verbal communication matters a lot, and then the non-verbal communication. Right. So whenever, what do you have to pay heed to this non-verbal listening? Maintain eye contact. These are certain things that we all do. Maintaining eye contact, makes few distracting movements. किसी भी वजह से हो, maybe it is because of your phone, or you have moved your head to see something, or you have responded to somebody, right? But these are distracting movements, whether it is offline or it is online session. Leans forward and face the speaker. So obviously this is a non-verbal communication which is kind of interested, that I'm interested in your life, and everybody wants that my doctor should be interested in my life. If we are thinking that the client is not thinking so, then we are mistaking. We are mistaking. We are not assessing, we are not the only one assessing the client, but the client is assessing ourselves much more than him. And we need to have an open posture. Open posture so shows that I'm approachable. Okay, you can share things about yourself. Allows few interruptions. And I suggest that please get rid of the interruptions. And this is how we create a physical and an online or offline therapeutic environment. Least interruption should be there. Unless there is an emergency, you should not get interrupted. Signals interest with encouragers and facial expressions. For example, the क्लाइंट आपको हिस्ट्री बताते बताते रोने लगा, और जब हिस्ट्री बताते बताते रोने लगा, सो व्हाट शुड बी योर रिस्पॉन्स? Silence is one response, but through your non-verbal communication, you can show that you are very strong. Through your verbal communication, you can say, I am with you. I can understand what you are going through. Right? So these are ways to convey small things. Then active listening includes these following skills. Attending, how can we do that? How to go about, we are talking about active listening a lot, but how to do that? Attend the client here and now, and then paraphrase. If the client is obviously in the first session, that means a history taking session, the client speaks about himself for good 45 to 1.5 hour maximum. And if the client feels that you are not listening to the client, then obviously the perception of the situation is different and it's wrong. So what is to be done? Paraphrase. So if the client has narrated a story and said, मुझे इस situation में बिल्कुल भी अच्छा नहीं लगा, I completely agree with you. I understand. आपको बिल्कुल अच्छा नहीं लगा. So this paraphrasing helps the client to understand that my psychologist is able to understand what I have gone through. And then reflection of feelings, the intensity with which the client has experienced those feelings should be understood by the therapist. You need to show that yes, I understand that intensity, although I cannot experience that intensity as of now as a human being, even if I am an expert, but I understand that what you have gone through. So you need to show it. And then suppose you have completed the history taking session, then summarize it at the end. ये हुआ, ये हुआ, ये हुआ, और अब हम इन सब चीजों पर काम करेंगे. And always say, correct me if you are wrong. Correct me if I am wrong in collecting the information. Right? Or you can use some other phrases as well. Attending is expressing awareness and interest in what the client is communicating, both verbally and non-verbally. Attending helps the clinician better understand the client through careful observation, and that too in relaxed environment, and obviously the client feels comfortable after that. Client should be able to express their ideas and feelings freely in their own way. That means a non-judgmental way, and trust the counselor and take a more active role in their own sessions. So there are different therapeutic approaches. I'm not going to talk about that, but in client-centered therapeutic approach, who is the center? Obviously the client is center. Who fixed the agenda? The client fixed the agenda. And client-centered therapy is a very strong approach. In CBT, in certain sessions, client can fix the agenda, but not in the initial sessions, later sessions. Right? Now moving on to rapport, which we always talk about rapport building. First 5 to 10 minutes are very, very important. How to do that? Building rapport with client in counseling is very important. Whatever model of counseling the counselor is working with, right? Because this is going to be the base for your future sessions or for your future multiple sessions. First 5 to 10 minutes, what is to be done? How to do it? I'll give you a demo here. विंध्या, आप कैसे हैं? Good morning, विंध्या, आप कैसे हैं? If you're in the practical, if you're taking it practically, I mean online, then you can say, okay, please make yourself comfortable. I hope your internet is working fine. I hope that you are all alone and you are able to talk to me. If it is offline, you can always say, please have a seat. Good morning, please have a seat. You can offer water, right? How are you? How are things going on? You have thought about a psychologist. You have thought about a counselor. There must be something which is bothering you. Do not say, what is the problem? How can I solve your problem? What kind of problem you are thinking to discuss here? Right? So problem, issue, these kind of words you avoid, please. Rather than these words, just say, how can I support you? How can I help you? So we are offering help immediately. If you are offering help immediately to the client in the first 5-10 minutes and sharing that I am very much interested in you. I have the solution, and don't worry, I will give you the solution. You don't have to say that, but you have to show in your body language. For example, my body language is this. My shoulders are like that. Okay, Vindhya, how are you? Good morning. Please have a seat. Make yourself comfortable. Neither my tone nor my body language is going along with it, right? Now, if my shoulders are upright and I'm in the right body language, very much interested. Hi, Vindhya. Hi, Fatima. How are you? Please make yourself comfortable. I hope internet connection is well. Yes. So comfortable you are? Okay. How can I help you? You have thought of a psychology, there must be something which is bothering you. This is the way through non-verbal communication and verbal communication. We need to create an environment where the connection between the therapist and the client can be established. So that this is how we create a warm connection. But if you have something in mind, negative about the client, this can never be created. Mark it a point. So you need to be a good human being first. You need to be an accepting human being first. Then only we can go ahead with this. If we are not accepting our client wholeheartedly, we cannot help our client, because my body language, my non-verbal language and my verbal language will not correlate with each other. Then comes paraphrasing. Paraphrasing is when the clinician restates the content of client's previous statement. We have already discussed about it. Paraphrasing uses words that are similar to the client but fewer, and the purpose of paraphrasing is to communicate to the client that you are being understood. Then paraphrasing helps the clinician in verifying the perception of the client, realize the counselor understands what they are saying, clarify their remarks, and focus on what is important and relevant. Reflection on feelings. This is also we have discussed, and now moving ahead, this is an example. When I get home in the evening, my house is a mess. The kids are dirty. My husband doesn't care about dinner. I don't feel like going home at all, and you are not satisfied with the way house chores are organized. That irritates you. Yes. So this last sentence is paraphrase. So this is an example. That's how we do it. And then summarize. Summarizing is an important way for the clinician to gather together what has already been said. So the client has already narrated the story, has narrated a lot of traumatic events or the root cause, right? And what we do, summarizing, is putting together the group of reflections. Plus, when we summarize, what I do is, when I summarize, I underline the thrust areas for myself. And if the client is interested in finding out the thrust area, then I say, okay, correct me if I am wrong. But these are the areas I feel that we need to work together. I don't say that you need to work on yourself. We need to work together on these areas, and together definitely we can make a difference. So this way the client doesn't feel offended. Summarizing helps the clinician to and provide the focus for the session, confirms the client's perception, focus on one issue while acknowledging the existence of others, terminate a session in a logical way. Summarizing helps the client in definitely many ways, clarify what they mean, realize that the counselor understands, and have a sense of movement and progress. So now, empathy. Empathy is nothing which I am going to explain it in a new way, but empathy is something, it's a biggest trait of a listening and empathy. These are the biggest trait of a good counselor or psychologist, because empathy means you are solution focused. Empathy doesn't mean that you are feeling the pain of the client. Empathy means that you are observing the pain of the client, and hence you want to give solution to the client, and hence you are focusing on the solution of the problem. So empathy is the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experiences of another. So the moment when the client narrates everything, that means a story or a traumatic incident, you say, I understand. I completely understand. You have gone through a lot. This is an empathetic action, but you are so strong. We will come out of it. Now, if you'll say you will come out of it, it is going to portray something else. But when you say we will come out of it, that means we are working together here in a session for the problem. Then comes probing. Probing is a technique that we use a lot, because when the client is discussing about his case, what happens, they tend to go haywire because they are so consumed by their life. They are so consumed by their negative emotions. So they tend to go haywire. So being a counselor, we need to have certain probing questions that can lead to a guided discovery. These probing questions help the client to reach out to their own exact issues, because most of the times when they come to you, they are not aware of their issues. They're not. They have issues. They are not functional completely, but then they realize that. But then they don't know that what is the actual issue. And they will tell you that. So probing is the counselor's use of question to direct the client's attention to explore his or her situation in great depth. A probing question should be open-ended. Yes, Socratic questioning. We always say probing question is always Socratic in nature. That means it is open-ended in nature. If it is open-ended, that means you will get a lot of information. One probing question can get a lot of information in different direction. Probing helps to focus the client's attention on feeling, situation, and behavior. It encourages the client to elaborate, clarify, and illustrate the issue. Probing may enhance the client's awareness and understanding about his own problem. So most of the time when the client comes to you in the first session itself, they feel so light. You know why they feel light? Please respond to this question in the chat box. Why they feel light after the first session? Anybody? Why they feel light after the first session? Please go ahead. There is no right and wrong. There's no right and wrong. Therapy acted as a catharsis. Okay. And okay, Abhilasha, yes, they feel heard. Most of the times they feel heard. Now, if I show you, this is a bottle. This bottle has something in it. Now, this bottle, this body and mind is just like a bottle. Suppose I take everything out. Suppose if not everything, even if something is out of it, there is a bit space which is created, right? And that's what happens. That's what happens in the first session. The client comes to you because the client has not feel heard for a long period of time. The client has not feel understood for a long period of time. That's why the client has come to you. So in the first session, they have shared a lot of things to you, suppressed things to you, suppressed emotions to you. Suppressed emotions are expressed in one or the other manner, which is why they feel light. And so after the first session, always the client say, "Mujhe session bahut acha laga." Although you have not contributed enough, because in the first session, you being the psychologist, you're always the passive participant. Who's the active participant? The client is the active participant. But still the client says, "Mujhe aapse baat karke bahut acha laga," because you have lend your ear 100% to the client for good 45 to 1.5 hours. Right? So now, next is, let me share. Okay, next is interpreting. Interpreting obviously makes a lot of difference, and I have already discussed it, that what the client intend to say, what the client say, what we perceive and what we understand, and then what is the interaction, that means the resultant of it. These are different, and that's why there's a disparity, and that's why the client is not treated on time, managed on time. Because of this disparity. Interpreting is the clinician's explanation of client's issue after observing the client's behavior, listening to the client, and considering other sources of information. Okay. Here I will discuss one dissociative identity case disorder, which I treated long back. I think it has been 7-8 years ago now. Now this lady was referred to me by a psychiatrist, and she was on medications for past 8 years. Now she had 5 different personalities. Then I the psychiatrist called me, ma'am, I'm referring this particular client to you because I cannot increase the dosage. And after increasing the dosage, she has started throwing seizures, which is not good for her. I said, if you are not able to do anything, and if she has been on medications for 8 years and on therapy also for so many years, then what can I do for her? She said, ma'am, aap dekh lena. Okay, the client came to me, and for 1.5 hours, I was a listener. She narrated her story in 1.5 hours. I took the cognitive history in detailed manner for 29 years, and I got to know that she was a case of sexual abuse. She was a case of why she was a case of dissociative identity disorder. At the age of 1.5 years, she was left to basically the mother was working, and she was working in some metro area, and therefore this girl was left with the grandmother. The grandmother was strict, the uncle was strict, aunt was strict. So she had the parents, but for good 21 years, and at the age of 22, she got married. So for good 21 years, she was with a very strict parenting where there were so many restrictions. And in between, there were abuses, physical abuse, verbal abuse, and then sexual abuse. And then there was a trauma. She saw when she was 7 years old, she witnessed an accident of the grandfather. And that was a very, what should I say? I do not have any adjective for it. It was a very tough for an 8 years old. Moral of the story is, after completing the session, she said, मुझे लगता है मैं ठीक हो जाऊंगी क्योंकि मेरी जिंदगी में मुझे किसी ने इतना सुना नहीं. And she was on medications for DID. And then I narrated, I shared the case summary with the psychiatrist, and the psychiatrist was also not aware of it. So she developed this DID because of these traumas. We worked on those traumas, and within a period of 1.5 years, she was absolutely fine. Within a period of 1.5 years, her medications were stopped completely by the psychiatrist. So moral of the story is, sometimes there are a lot of misdiagnosis also, because this particular case was, her initial diagnosis was schizophrenia, then changed to bipolar, then changed to major depressive episode, and then changed to dissociative identity disorder. Right? But for me, she was a case of obviously dissociative identity disorder, but trauma. She was a case of trauma. And I treated her in line with, I managed her in line with trauma, with the trauma management, multiple trauma management, complex trauma management. Right? Moral of the story is, I don't know whether we psychologists do not have time to collect these details, or we don't want to do that. I do not know. So there are a lot of psychiatrists and psychologists. They are ready to give good time to the history. Even if your client is saying, my history is not complete. Even if you have to take 2 sessions, it's absolutely fine. Because history is everything. Remember that. History of a client talks about a lot of things, and history of the client has a solution also. Once you have got down to the root cause of the solution, once you have basically pinpointed the root cause, the solution, you know about the solution, you know where to work, right? Okay, moving ahead. So effective interpreting has 3 components: determining and restating basic messages, adding ideas for a new frame of reference, and validating these ideas with the client. And then silence. I've already discussed about silence, that wherever you cannot endorse or wherever you cannot validate, silence speaks the language of 1,000 words. So silence can encourage the client to reflect and continue sharing. It also can allow the client to experience the power of his or her own words. It can be an encourager for the client, and it keeps the focus on the client. It can help the client absorb what was said. Also, it can help the client collect his or her thoughts for expression. Then there is self-disclosure. Sometimes, not in the initial sessions, but if there are situations where you are making an attempt for self-disclosure, be mindful. It should not hurt the client. So sharing personal information with the client is called self-disclosure. And I'm talking about, suppose if a psychologist is saying, okay, mere saath bhi aisa hua tha. It must be for the benefit of the client and not the counselor. It can be used as a model to help the client with client self-disclose, and it should not take the focus off the client. And it should not offend the client in any way. Use sparingly and appropriately. It can enhance a therapeutic relationship. Okay, in one of my sessions today itself, obviously the life of this particular client of mine was very traumatic, and she lost the father when she was 16 years old, and she has the mother. And she said, I basically completed her sessions today, and it was her follow-up, last follow-up. So she said, मेरा अपना एक घर होता तो कितना अच्छा होता. I said, you have a house, you have a mother. नहीं, मदर तो है, फादर भी होते तो कितना अच्छा होता. जैसे बहुत सारे लोग होते हैं जिनके पेरेंट्स नहीं होते और बहुत अर्ली एज में उनके पेरेंट्स जा चुके होते हैं. एटलीस्ट आपके पास एक है. यू शुड बी हैप्पी अबाउट इट, एंड यू शुड relish that moment and relish that relationship. I said, मैंने आपको कभी नहीं बताया. It has been a year now. I lost my parents when I was 17. So what I do is I relish only the positive memories. I don't think about the negative memories. So when I think about my mother, I should always be proud of who I am. I should always be proud of those moments that I've spent with her. I should not repent that I lost her when I was 17. Then she said, मुझे ऐसा लगता था कि जिनके पेरेंट्स नहीं होते वो कैसे होते होंगे, क्योंकि मेरे तो एक नहीं है. And then I feel bad. Moral of the story is, in this particular case, I knew that in this particular relationship, it is going to enhance and it is going to motivate her. That's why I shared. So self-disclosure, yes, you can go for, but you need to set the fixed boundaries for self-disclosure. You cannot go on and on and on. And then confrontation. Confrontation doesn't start at the starting of the counseling, but in the later counseling sessions, confrontation means not to argue, not to fight, but to show your incongruence, not disagreement. Incongruence, okay. ऐसा सोचते हो, बट शायद अलग लोग, सभी तरह के different point of view है लोगों के सोचने के. So you can always show that confrontation, but it is an advanced counseling skill that we use in the later stages of counseling sessions. जो start कर रहा है वो confrontation से ना करे, क्योंकि confrontation needs a base. Then immediacy. Immediacy is also an advanced skill. Immediacy means that the therapists reveal how they themselves are feeling in response to the client. Immediacy is the key skill of focusing attention on here and now relationship of the counselor and client, with helpful timing in order to challenge defensiveness and heightened awareness. जब हम client को कुछ समझाना चाहते हैं, the client is not ready to understand, तो आप immediacy use कर सकते हो कि again in one of the session I use this immediacy today because it was, I think, 10th or 12th session for her. And the person keeps on reflecting back onto the past. The person has moved on a lot, but a particular incident wherein the tie is still attached. Everything is resolved, but the person doesn't want to talk about it. So that is remaining. So I taught her the concept of here and now. That yes, if you are here, you'll relish this relationship. But if you'll go into the past again and again and pick up the negative memory, this will not help. This will drag you down. Now it is completely upon you. What do you want? because we want peace, we want happiness for ourselves. So immediacy is again an advanced counseling skill wherein we teach the concept of here and now. So now these are certain basic skills of counseling, and that's all from my side. If there is any question, I would be very happy to take that. Any question? Yes, please go ahead, Hadia. Go ahead. You can unmute and ask. Go ahead, please. Isn't it tougher to read the body language and facial expression during online sessions? I think online counseling make it harder to understand the full picture of what someone is going through. Okay. Yes. So at the starting of the session, I said online session and offline session are two different modes. Criterias are different, but have the basic skeleton, right? So when it comes to the body language in the offline session, I have already mentioned the statistics. Is it 8% words, 57% non-verbal language, and rest is your tone, amplitude, and pitch. But in case of the online session, shoulders, you are aware of shoulders and the face of the client maximum of the times, or up to the chest region, not that. It is difficult, but that's why we have many courses on telecounseling, right? So perceiving the language is not difficult, and we need to learn it. I think the first talk that I gave on the body language during the telecounseling sessions, the communication between telecounseling session, was in Amity University, Noida. And that too, it was in COVID 2020, right? It is difficult, but it is not impossible. And we have to have expertise in both. We need to understand both. So, for example, I'll show you. Suppose I am a client. मुझे बिल्कुल अच्छा नहीं लगा. मुझे बिल्कुल अच्छा नहीं लगा. Now my shoulders are down. मुझे बिल्कुल अच्छा नहीं लगा. मुझे बिल्कुल अच्छा नहीं लगा. Now these are the things that we need to read. मुझे बिल्कुल अच्छा नहीं लगा. मुझे बिल्कुल अच्छा नहीं लगा. Now these are for different issues. So this is what we need to have expertise for. This is what we need to, when we look into the eyes of the client, we should be able to understand what the client is going through. And this is the kind of connect that we need to develop. And we develop it, obviously we develop it over a period of time with certain experience. And when you'll, Hadia, are you a student or a professional? If you are a student, then you will get to know. A research scholar, yes. So start observing people. You'll get to know. It's all observation. In psychology, observation matters a lot. So start observing people. If you want to be a good psychologist, there are 2 mantras. Apart from basic skills, there are 2 mantras. Be a good human being. Be a good observer. Rest, you will learn. You will learn in your bachelor's, master's, and PhD. Right? Okay. Yes, please, Yamini, go ahead.
Ma'am, I'm unmuting myself. I hope that's fine because I thought writing the question would be too long. Ma'am, I had a question when you said that case study where you, the dissociative personality identity disorder case study. So I had this question that if a person dissociates in front of you while you are having that session or something, like, because how much I have read, I have understood that sometimes other